else, if you're doing bridges or bridge progressions and you feel fatigue or tightness in the hip flexors afterwards, that means we're not engaging the right muscles and we're not working the right thing. And that's telling us our foundation wants a little bit more deeper support. Oftentimes, especially if, whether it's like the hip flexor, so if we think of like, we have our psoas that starts up here on our low back and it kind of comes down here to our thigh. We have our iliacus here, and then we have our TFL that almost, it's like a tiny muscle. It sits over here to the side. So when we're feeling pain or tightness in any of those regions, especially if it's like a pretty consistent or chronic type of tightness, and let's assume everything is going well with the pelvic floor, what is maybe going on with the adductors? Liz, I know you've been working on the hamstring activation, which is great, but maybe that next step is doing a little bit more adductor specific strengthening with the pelvic floor before we then test the hip flexors that much. Because when we have like a dominant TFL, on one side or both sides, honestly, it could be either, but especially if it's on one side, that means our adductors are weak. And we know from last week's conversation how much the adductors have to not only support the pelvic region itself from a stability standpoint, but they also need to know how to work separate from the pelvic floor and in addition to the pelvic floor. And so maybe it's just cueing your body a little differently so it starts to integrate both regions better, so that something like a bridge with more challenge doesn't feed into that hip flexor region. Because that also too can often correlate within that SI not being happy and acting up. So that all kind of really makes sense. So here's the thing about SI joint pain. In general, so let's say foundationally pelvic floor wise things were good and your SI was still having that same like aching discomfort, that is often a time where adding some extension, so like a bridge where you're like a closed kinetic chain extension where your foot is on the ground, you're pushing up through the foot to get your hips into extension, that motion, or even something like a clamshell where we're externally rotating to almost, so if you think of your SI back here, we're externally rotating to compress and provide stability here. So that is one of the benefits of clamshells. I know clamshells get a bad rep, even like for me, I think they're overprescribed at the wrong times. But for SI joint pain, when everything else within the pelvis is good, that's where maybe adding more of those external rotation movements or extension movements in a closed pack position can be helpful. However, for you, I actually think there's a deeper underlying limitation first that has to be addressed within the pelvic floor and adductor component, because it's almost like our SI joint isn't going to like that compression until everything deeper can fully lengthen, can fully contract, and feels good. So if we're trying to compress on something, but deeper, it's a little bit too tight or too restricted or not happy, then that clamshell is going to feed back into your pain or just not make a difference. So what I'm trying to say essentially is maybe next time as we're progressing bridges, instead of having the band above your knees and focusing into the abduction motion, we first need to actually bring the roller between your legs to use more of the adductor work with the pelvic floor work to get you solid through that extension motion before we then add that next layer of, okay, now I'm going to challenge my hip abductors, my external rotators, my glutes versus my hip flexors, right? So it's almost like just backing off a little bit, getting a little bit more solid with the foundation, and then adding that next element. And that's for somebody who has SI joint pain, if you try something like a bridge or if you try something like a clamshell or even sometimes a side plank and it doesn't feel good, that usually means we need to attack the front end or the deeper part first before it has the opportunity to benefit from the movements. When we're talking about having back pain or a pain, like an aching dull in the SI joint or the piriformis region, that's often where, depending on what's more prevalent, so a lot of people are going to have hip pain, they're going to have back pain. And what the low back might need is maybe going to feed into the hip pain if we don't first figure out what's going on deeper that's affecting the hip pain. and vice versa, right? So there are a lot of situations where we're going to have a couple of different body parts talking to us, and what might help one or what one is needing is going to feed into and flare up the other one. And so understanding which one we need to address first allows us to be a lot more straightforward as far as like guidance wise and foundation building wise, so that we get to the back pain once the pelvic floor or the hip or something else has been resolved, knowing that the back was maybe that third trigger, that third level of what your body needed to be addressing. And we do different tests and things like that for these types of pain points or body regions. As definitely, we see it a lot. I wish it was more straightforward, but I think as you start to understand the concepts of why maybe progressing this fed into that, it makes it a little bit easier to peel apart certain things that maybe aren't serving you or your body isn't ready for, and then just focus on the rest that it really is. There was one other question that came through from a client who's not on this call, but it was similar to our conversation earlier about hip flexors. And Liz, this might help you too. When you're feeling like soreness or aching or some discomfort after the activity, sometimes a great tool to help kind of flush out or minimize the intensity of what you feel is to load the tissue. So an isometric contraction or an eccentric contraction. And so, for example, if we're talking about the hip flexors, and let's say we were somebody like we're sitting, right? So hip flexors lift our knee up. So if we're sitting, our feet are on the ground, and let's say it's your right hip flexor. So you're lifting up your right knee into your right hand, but you're pushing down on your right hand. So it's like you're creating tension between your knee and your hand, but you're not like moving your knee up or pushing your knee down. It's just that isometric hold. Oftentimes I will have clients just do that during their workday, and it helps minimize that discomfort because it's almost like reactivating that brain body connection for one, but also just that contract relax technique can be very helpful for pain as well. So if you're somebody who's having hip flexor pain or hamstring pain or glute pain, like whatever it may be, and it's more that dull or achiness or even soreness after doing an activity, you might just try activating it for a couple of seconds and doing a couple of reps of that to just like tell the brain like, hey, I'm not ignoring this. Like, I feel you. Here you go. Here's the thing you wanted. Now be quiet for, it's almost like a little kid. It's like, oh my gosh, you want this toy? Great. Go play with it. You're going to be distracted for maybe the next 20 minutes. And then if you come back, great, I'll give you something. So it's like just being able to do that for your brain and your body so that you can sit longer or you can walk longer or you can do whatever it is without that trigger coming back. That can be another way to use some of these tools in the short term.